Hi, my name is Sean Duffy. I'm at San Francisco Bay Area Hospital, Kindred Hospital. I'm Director of Education. We're getting some new central line dressing change kits for portacas, central lines, peripheral IVs. There's a new component with this. It's a CHG component. There is no more BioPatch. BioPatch went away. No more StatLock. StatLocks went away for the lines as well. So it's important we review the new kits so that you're prepared to handle them when they come in to supply. So the first thing is that the kit looks like this, and that wasn't supposed to happen. The kit looks like this. It will say central line dressing change on the kit. Okay, that way you know which one you're pulling is correct. On the inside, you can see there's saline, there's some caps, stuff like that. We're gonna start with pulling these two green pouches out. These two green pouches are clean on the outside and sterile on the inside. So one is an application set and one is a removal set. Okay, so you'll of course start with the removal set. The removal set is to take off the old dressing, and the application set is to place the new dressing. Because this doesn't have a dressing, we'll do removal set next. I'm going to start with the application set. I'm going to open up the application set carefully as to not touch anything in the sterile area. When I do open, I'm going to take it here and I'm going to open it away from me in this manner. If you can see, the kit goes in order. We're going to pretend that I just took off the dressing. You have hand gel to put on before you apply your gloves. You have your gloves to apply. If this set of gloves doesn't fit you, please make sure that you grab another pair of gloves that do fit so that you have that available. So I put my gloves on, and now we're ready for part one, which is cleaning the site. This is my chlorhexidine scrub. It's called a scrub for a reason. When you do it, you apply friction, and as to remove all the bacteria from the site. It is a squeeze handle. I would squeeze this, get the solution down to the site, and then I would start scrubbing. And I'm going to scrub the whole area, and I'm going to go around and around and around my site. I'll let this dry for 3 minutes. I have to let it dry appropriately because the CHG on the dressing, I'm putting that in my garbage. The CHG in the dressing is not compatible with the any of the cleaning agents. Okay.
Okay, I just want to say something on that cleaning.
Yes, Jen.
You might want to cover the large area up to the lumens,
Yes,
all the way up to the lumens.
Sorry about that. You want to cover the area all the way up to the lumens here. You cover a large area because the dressing is rather large and you're just trying to protect the patient better. Thank you. So I scrubbed, I've let it dry for 3 minutes, and now I'm going to actually use my no sting barrier film. This is a peel, actually this one is a tear. So you're going to rip this and you're going to pull it out. And as you can see, it has a flat head. It's designed like this for a reason. The flat head is intended to make a square. So I'm going to draw a square on here from where the chlorhexidine dressing is going to be sitting, okay? Because these are not compatible. So I have my square with where I'm not going to fill in this solution. So I'm going to go around the box that I made, just like I would doing a dressing. This is a skin protectant. It's to help prevent any skin injuries with the sticky side of the dressing. I'm going to discard this. I'm going to let it dry. So we're going to pretend that this is dried well enough. I'm going to take my dressing. I'm going to peel back my dressing. Take off the first layer. I'm going to place sticky side face down. You can come at this from two ways. So just remember that the hole in this dressing, it's shaped in what's called an omega sign. The omega sign is intended to remind you to place it in the right direction. But I like to think of these as feet, and the feet go towards the lumens, okay? So when you do this, you can do it taco style, or you can do it flat. I prefer flat, but you have to be careful when you're doing flat as not to pull the dressing. Okay, you don't want to pull against the dressing, because what happens is it doesn't apply as well to the skin, and there's risk for infection, okay? So I'm kind of going at it my way like this, but when you're doing this, you want to look through the window of the CHG. You want to center it over the site, but you also, I'm going to take it up to just about right here above my wings on my dressing. And the tape is going to go right above the wings. Okay, so I'm going to lay it down gently, and I'm going to start in the center, and I'm going to press. I'm creating a seal as I do this. I'm going around the dressing, pressing and creating a firm seal. These ends can come up like this, and I can, as I continue to go around, I can get that down, go around on this side, and these two tail ends should close together, creating a close seal. Okay, this process should take about 7 seconds, and the myth is for every second it adds an extra day of being good against infection. Okay, so that's on. I'm going to start removing my paper. So as I remove my paper, I'm going to go back over the edge here with my fingers, creating a better seal. Okay, on the tail ends, there are still tape pieces. We still use these to continue the dressing change. So I'm going to take the tape off the big piece, okay? You can still see it has these two tabs on it. That's there for a reason. We're going to lift up on our catheter, and we're going to place one side. We're actually trying to close the hole here. So as I pull up, I bring the catheter ends in, and I press on my tape. Okay, so as you can see, I have a small hole here, and it's small because of the position of the tape. I'm going to take these tabs off, and I'm going to seal the deal here. If you have a hard time getting these tabs off, you can pull them back and push out this way, and the tab will come off very easily, okay? All right, next we still have one piece of tape left. This is the label tape, and we're going to use this as the final piece here in the project. So label, we're going to come up, oh, sorry. We're going to go over the site, over the hole, to seal the final deal, okay? And I'm kind of lifting up on these catheter ends so that it wraps more around the site. Oops. And you get a good seal, okay? You take the ends off. And that's it. That is how you apply the new CHG dressing by 3M. Okay, there's a couple of points that we want to say about this, and I'm just going to read from the paper. So, the dressing should be changed if the gel pad remains displaced or when pressed with a finger.
If there's an indentation.
So what you want to do is you want to press on the gel pad. If it leaves an indentation, the dressing needs to be changed. Okay? Also, you'll change the dressing every 7 days, as usual. When the dressing becomes loose or soiled, you'll change it. If it's draining, like serosanguinous fluid or bleeding a little bit, you'll change that every day. Okay? We don't use gauze on these dressings. The CHG cannot go over gauze or it does not work. Okay, again, remember we've gotten rid of the BioPatch, so the CHG is replacing that, and it's important that we have that as an extra barrier of protection, okay? If the gel is saturated or if there's swelling, visible drainage, or loss of visibility, okay? That's when you change the dressing. Okay, we're gonna move to removing the dressing. So I have my removal kit. Again, I'm gonna open this up. So this would be the first step, unless this was a new site. I have my mask, I'll put my mask on. I have my hand gel, I'll put my hand gel on. Then I'll put my gloves on, okay? I'm not gonna touch this drape. I'm gonna save this drape for when I'm actually doing the dressing change, okay? So I have my gloves on. So the thing is that with these, they're really easy to come off with rubber gloves. If you just start to roll back, it creates an edge for you to pick up from, okay? What you want to do is you actually want to remove the top layer first, which is the label. Next, the second piece of tape. And sometimes this sticks, so you have to come at it from the opposite direction, okay? So I'm just getting it to roll down, and I'm removing that as well. Next is the dressing itself, and see how easy the edges come up. So with this, depending on how long this dressing has been here, the CHG does adhere to the skin very well. It actually like almost becomes part of the skin, an extra layer of skin. So anyway, I'm going to pull back my edges and I'm going to go low and slow. And as I'm pulling back my edges, my CHG is going to start coming up. Now, you want to be careful because you don't want this to rip or tear. And this is actually sticking. So when it starts sticking, you can actually take a piece of the tape and press it onto the CHG to get it to pull back the CHG, okay? So as you can tell, that worked very well. Again, you do not have to rip this off or go fast with this. It will come off. And that's how you remove the CHG dressing. That is it on this training with central line dressings. And please watch the other two videos and then come get checked off. Thank you.